Are you tired of living with constant neck pain because of a C5, C6 disc bulge? Imagine waking up every morning free from this excruciating C5, C6 disc bulge pain. In this video, you're going to discover a groundbreaking method to restore your cervical spine health and eliminate the pain from your C5, C6 disc bulge, all from the comfort of your home. I'm going to show you safe and easy at-home techniques for managing a C5, C6 disc bulge using readily available equipment and advanced methods involving the Dentrol Spinal Orthotic device. This corrective spinal orthotic is developed by top professionals and researchers, and it addresses one of the core causes of the C5, C6 disc bulge and loss of cervical lordosis. By the end of this video, you'll be equipped with powerful tools and techniques to not just manage, but potentially reverse the debilitating effects of a C5, C6 disc bulge, restoring your cervical spine's natural curve and remaining for your life. Hi, I'm Dr. Raminder Burke, a chiropractor in Woodbridge, Ontario, Canada. We have helped thousands of patients recover from spinal conditions such as disc bulges, herniations, degeneration, lumbar stenosis, sciatica, radiculopathy. We use non-surgical decompression as the cornerstone of our unique and proven Back to Life method. Be sure to hit that subscribe button if you want do-it-yourself tips, strategies, and exercises that will help you relieve and manage your back and leg pain at home. Plus, you will discover which therapies are the best for treating bulges, herniations, and other spinal degenerative conditions. I'll upload a new video every week. In addition to that, I wrote a book called Back to Life. Imagine getting your life back while getting your health back. You can get a free copy at the link in the pinned comment below. Now, before we dive into home methods for addressing a C5, C6 disc bulge, let's first understand the normal anatomy of the neck. What we're looking at when it comes to your spine in general is that there's three curvatures in our spine that you need to understand. The most important when it comes to the cervical spine is that it has a curve, a C shape called a lordosis. And then the kyphosis of our thoracic spine would be relaxed if this is healthy. Following that is our lumbar lordosis. So all three curves in our spine are vital for the health and shape of our spine dictates the disc health that we're going to discuss, especially when it comes to a C5, C6 disc. So all of these are normally shaped in this curvature, and that's what we want to see when it's healthy. The key thing that this does is it keeps the curvatures, keep the discs healthy. So if we have a healthy curve in our spine, that disc is not taking any stress. It's supposed to be on the back of the spine. The weight of our head weighs about the weight of a bowling ball. So when we think of this, 10 pounds, 8 pounds, weighing on the back of the spine where it's meant to be means that the load is on the bones of the spine. When this transfer happens where there's a posture change, we're going to get into what that does to these discs at the root cause of the spine. So one of the key things as we talk about the curvatures in the spine, why that's so important is a whole is that the spinal cord runs through here. So when your spinal cord is relaxed in your neck, having a curvature means you have a relaxed spinal cord in your neck. That spinal cord, of course, transfers all the way down to the spinal cord base at the tailbone here, your sacrum. So whatever happens in your neck determines what happens in the rest of your body, including obviously your nervous system, which controls every function in our body. So having a curvature, a C-shaped curve in this lordotic shape in our neck determines the wellness of your entire nervous system. So how relaxed it is up here dictates below. So that's what I want you to understand. And what happens when it changes? When it changes, as we mentioned, going forward, loads the weight of the head onto the front of the spine. So if these are where your discs are and they're not meant to be weight bearing, that's when we see these degenerative changes happen over time. So first is normal. The second is a compressed disc due to that situation where you've lost curve in your neck. Now we're looking at a compressed disc because it's taking the weight that's not meant to be. So as it's losing fluid, that C5, C6, it tends to happen in the lower neck first because of obviously the weight of the head being forward means the more load goes to the front of the spine. So that lower spine, I mean. So as the discs are getting compressed down here, that's when we start feeling sensations, whether it's neck pain locally first with inflammation, transferring to the traps, the shoulder, the arms, hands, numbness, tingling, weakness, all of the things that you may be already experiencing with a C5, C6 disc bulge. So that's what I want you to really understand is that the change in your posture that happens over time, whether it's a car accident or slowly, we lose that curve. We go from being in a healthy curvature to forward head posture, military neck, we call that. Loss of curvature is going to create this curve going straight. Straight means tension. So what we look at when we talk about that is if I have a healthy neck and it's curved, the muscles, the spinal cord, the ligaments in the back are going to be relaxed. In the front, they're not going to be overstrained. But when we take that curve and we lose that curve, basically we're causing a stretching of these ligaments. Tension builds up in your muscles. You're going to feel that first. But over time, that's the degeneration that we're talking about that's associated with this. So the C5, C6 disc bulge means you've had a change in your neck posture for a long time. It's going to take time to restore, but we're correcting the cause. The load on the wrong side of your spine is the root cause of these degenerative disc problems. So the only way to really tell, obviously your posture gives a window to your spine, but when we look at this on x-rays, that's how I can really see what's happened. What we can tell in the x-rays is several things. The most important thing we're going to look for is obviously the shape, the general lordosis that we've talked about. The curvature in this spine is going to be obvious on an x-ray, whether it's healthy or not. As we go down this path of straightened military neck, loss of curvature, a reverse curvature, but also some patients actually have an opposite curvature. So we talk about having a cervical kyphosis. The more obviously it goes in the wrong direction, the worse it is, the faster it degenerates. So those lower neck vertebrae are getting more strained as you have an opposite curvature in your spine. So we see that in people who've had car accidents. I see that a lot in people who play football or hockey or gymnastics in females, soccer. Heading a soccer ball can cause that. That effect into the neck leads to a lot of situations of pain, obviously headaches, fatigue, so many other symptoms that come with that. And then on the x-ray, we can also see these degenerations. So the further this has waited, the longer it's been going down this road, the more we're breaking down. And we literally see these on your x-ray. So only on an x-ray can I tell to the degree of your severity. Arthritis is a very general term. We're going to look at this at stages and levels that are correctable, reversible, or treatable, and only manageable. So we want to let you know the honest answer as we get into x-rays, but that is evidence of the truth and not just guesswork. So when we look at x-rays, that's the way we can tell. And from those x-rays determines placement of specific devices we're going to use to restore curvatures if we still can, and help alleviate the cause of the C5, C6 disc bulge situation. So this is where these home corrective methods and exercises come in. We provide patients with 2 key exercises to perform at home, causing stabilization and correcting abnormal curvature and spinal alignment while reducing the symptoms of the C5, C6 disc bulge. These exercises complement our in-office corrective care treatment programs. First, we recommend a warm-up exercise that can be easily done with the use of a towel at home. So simply take a towel, roll it up, and get ready to use it. As we roll it up, we're going to place it on the back of the neck and create a nice holding that forward with the elbows pointing forward. We're going to turn here just to show that Donna's placing it and just giving it a gentle pull. So this is going to be the preliminary method. As she brings her head back, it's going to provide more of a deeper stretch and helps traction and create pressure and relieve the curvature into the spine. When you're doing this, you're going to feel this relax all the way down. Now, some patients find this a little bit difficult. When you want to do it, the other way that you can do this is to just hold in a neutral position and more upward pressure. So you're going to apply up as she pulls forward and up. It's going to create that nice deep stretch at the base of the skull, creating a mild traction effect on the back of the neck. So this is very effective, and some patients feel that this will provide enough of a stretch. The others that have it going down one side or the other, Donna can pull forward with the right hand, for example, and create a tilt and a stretch into that right side, at the same time providing traction and relieving that. If we pull the other way, bringing this neck forward here, this arm, it's going to provide the left side of the neck relief. So that C5, C6 disc bulge can either be causing an arm one-sided pain or the other. This will give you more of a deep stretch in that method. So this is what I really start with all patients, coming back to neutral, relaxing the arms down, taking a break for a second here. We're going to repeat this 30 seconds at a time. Repeat this 3 times, a couple of times a day, morning, evening, whenever you find you have time to do this. It's going to provide you a nice, deep stretch, and traction through your spine. That's the towel stretch. So next we proceed to the cervical traction with use of a specialized research-based spinal orthotic called a Deneroll. So this is a cervical Deneroll, which means it's designed specifically for your neck. It comes in 3 sizes, small, medium, and large. It's a prescribed spinal orthotic, which means it's prescribed by a qualified and trained doctor and is given only after a thorough examination, spinal x-ray evaluation. So there's no guesswork here. And the Deneroll is not available from any retail sites like Amazon. So we want to make sure this is placed accurately for your spinal disc condition. And the purpose of the Deneroll is obviously, most importantly, is to restore that curvature. So as we've talked about these forward head postures, loss of curvatures, reverse curvatures, the Deneroll is designed specifically with research-based backing. The research shows that this creates curvature in your spine again. Purpose of that curvature is to take the load off your C5, C6 disc. So remember, those discs are compressed because they're not in extension, they're in flexion. These bones have locked and compressed on this cartilage. We're obviously restoring curvature to get to the cause of the problem. Restoring your curvature also relaxes your spinal cord. So that's going to relieve the tension on your head, headaches, fatigue, sinus troubles, all of the stuff that's in the head and neck. It's going to relax the spinal cord, even down to the lower back for people who have lower back conditions. So the Deneroll is vital for restoring your curvature, and we're going to show placement next. So basically, lying on the floor, this is done on a firm surface. If you have a yoga mat, go ahead and place it underneath to give you a little bit of a cushion. Donna's bent her knees. It takes a little bit of stress off the lower back, so you're not straining your lower back. Most patients find that very comfortable. You can always tuck a couple of pillows under your knees to help just relax your legs even more. So we have the Deneroll here. This flat side literally says on it, shoulders this side. So of course it's placed with that going towards your shoulders. The neck and the position of this is determined by a few key factors. We've got the ridge on here, which is where we really want to focus the pressure that this applies. So what I like to tell patients is, you're going to take your fingers and go to the back of your neck. There is one that sticks out more than the others. So that's going to be C7. So C7 and just above that at C6 is placement for most patients. So you're going to feel the one that sticks out the most. You're going to feel the one that's just above it, and that's C6. So we're going to get to the lower part of the neck. Most people are forward in their head posture. Creating this fulcrum over that area is going to pull the head back as well as decompress some of that tissue at C5, C6. So we're going to place that, as I mentioned, at the lower part of the neck. Donna's C7 is right here, I can feel. We're going to tuck that down. Most patients find it comfortable right away. You're going to try and get your head extended back, relax over that, touching the floor with the back of the head and feeling that deep stretch. So we're doing a few things. We're restoring curve in the neck. We're stretching the ligaments in the front of the spine and just pulling the head back gently over time. Normally we'd start with, there's a schedule provided. As you get your Deneroll, it's going to start with 1 minute or 3. So most patients can tolerate about 3 minutes to begin. As you do this daily, you're going to increase it by 1 or 2 minutes at tolerance, right? So everybody's different. If you've had this degeneration for so long, your C5, C6 disc is bulging, you're going to take your time with this. We're not going to rush it. We need to keep it at 3 minutes for a few days. Take your time. So you're going to gradually increase this incrementally. So as that's done, you're going to feel this relaxation effect over time. Most of the patients immediately respond. I notice when I work on them that they're much easier to work on. Their spine is easier. It's more relaxed. It just immediately takes effect. So the Deneroll is a very powerful tool. It may not seem like much, but the specificity of this and the way this is designed is really going to open up your cervical spine. So that's what we start with when it comes to this. The key things I want to also mention is, if you're feeling anything negative, meaning you feel this going down your arms, numbness, tingling, lightheadedness, dizziness, headache after, we're going to talk about these things in office, but obviously take that away at that time. Stop the Deneroll. Let's make sure what's going on so we don't force anything. The key things with that. And then the way that placement is, if you're ever doubting how you've placed it, always have someone take a picture and show it to your professional and say, does this look right? Am I placing this correctly? Many times if it's placed too high in the neck, that can aggravate, that can cause headaches. You may be too much right on the problem area, and that's aggravating it and creating tingling or numbness. So that's how we know when it's placed correctly, is by having someone take a picture of you. We'll be able to see if it's placed right. So that's some of the main key things to look at. Take your time with this, relax into it, and it's going to take a really great effect on the curvature restoration and cervical spine. So a few things and a few reasons to avoid using this are contraindications, obviously. So certain contraindications: instabilities, anterior listhesis, large forward head position, increased upper thoracic kyphosis, where it's very severe, where an exam and x-ray will determine this, obviously dictated by your professional who knows what they're doing and when it's needed, when it can be used, and when it cannot be used. That's why it's very important that this is not just done at home independently or on your own or grabbing it from a friend or a website. We really want a professional to dictate how and if you use your dental roll. So as you go finish your timing on this, one of the most important things is how you get off of the dental roll. We don't want to strain your neck coming up. Don't get up straight up. Obviously, that can strain your neck. You're in a relaxed position. Your neck is actually changing. So it's not as like ready to be opened up and getting up right away. So I always want a patient to turn on their side. Go ahead and turn on your side there, Donna. You're going to roll over, slowly use your arms to push yourself up into a seated position from there, and then relax. Wait a minute, take a few deep breaths, let that settle down, feel that in your cervical spine, and that's going to feel really relaxed, but also just feel that movement, turning left and right. Turning your head left and right will also create some movement. It just opens up these joints that have been in this new position. You're going to start feeling that freedom in your neck. And then every session, that's how we could get off. Remember, consistency is key when it comes to these at-home exercises for managing your C5, C6 disc bulge. And remember that the dental roll is a prescribed spinal orthotic. If you need help finding a corrective care chiropractor in your area that is trained on the dental roll spinal orthotic, let me know in the comments section below. And I will do my best to help you incorporating and finding one. So incorporating the towel warm-up exercise and the dental roll spinal orthotic into your routine not only helps support your in-office treatments, but it helps you achieve the best results for your C5, C6 disc bulge condition. If you found this video helpful, please hit the like button and subscribe to our channel. Share it with others who might benefit. Don't forget to grab your free copy of the Back to Life book with the link in the comments and below. The next video you should watch is this one, where I explain in detail how to treat a C5, C6 disc bulge without surgery. Go watch this video now.